A 35-year-old man comes to the physician with dyspnea for several months. His previous medical history is unclear. His blood pressure is 130 over 60, and his heart rate is 130 beats per minute. Auscultation of his abdomen finds hypoactive bowel sounds and a bruit. Which of the following is most likely in this patient's history? Choice A, bicuspid aortic valve. Choice B, Marfan syndrome. Choice C, prolonged immobility. Choice D, penetrating trauma. Or choice E, smoking. I'll wait 5 seconds and answer the question. This patient has dyspnea, tachycardia, and a wide pulse pressure. Wide pulse pressure is when you take the difference between systolic and diastolic blood pressure, and the difference is really large, usually above 60. A combination of these symptoms alongside the abdominal fluid suggests high output cardiac failure resulting from an AV fistula, which can form as a result of a penetrating trauma such as a stab or gunshot wound. Choice D, penetrating trauma, is the correct answer. Now, the symptoms you find here, tachycardia, dyspnea, and stuff, they are non-specific by themselves, but this combination of symptoms is pretty suggestive of high output cardiac failure. But even if you don't recognize that, we can get the answer here by eliminating. So let's look at some of the other answer choices here. Choice A, bicuspid aortic valve. Now, this is a common cause of various aortic valve abnormalities, including stenosis and regurgitation. Regurgitation being the one we want to focus on here, because in aortic regurgitation, we would also have this wide pulse pressure. However, the abdominal bruit is not typically found in aortic regurgitation, and questions that ask you about aortic regurgitation will often have other symptoms such as head bobbing or bounding pulses, is what they call it. The wide pulse pressure actually manifests as a physical movement where the high systolic with the low diastolic, you see their head bouncing up and down, basically. And I also don't mention a murmur here, but aortic regurg would be a diastolic decrescendo murmur, usually best auscultated at the left sternal border. Choice B, Marfan syndrome. Similar to choice A, this can cause a variety of aortic related abnormalities, which again, most notably aortic regurgitation is the one you would think of because of this wide pulse pressure. But again, abdominal bruit is not found in aortic regurgitation most of the time. And this patient just doesn't have any of the Marfan syndrome findings that you typically think about, right? He's not really tall with long extremities, hypermobile joints, just doesn't really fit. Choice C, prolonged immobility. Obviously, this is referring to a risk factor for DVT and eventually pulmonary embolism. This would not have a wide pulse pressure or an abdominal bruit, so not a good answer choice. Choice E, smoking. Obviously, I threw this in here because you get told by a lot of resources that if you don't know what's going on, you should pick smoking. But smoking is a risk factor for various cardiac illnesses, atherosclerosis, and a bunch of cancers. But something that causes a wide pulse pressure and an abdominal bruit isn't typical of one of the things that you would associate with smoking. So coming back, the takeaway you want to have here is that you need to understand that a AV fistula can form as a result of trauma, and you need to know that an AV fistula can cause high output cardiac failure. And the reason that happens, of course, is because when you're shunting blood from the arterial system into the venous system, you're going to have a lot of blood flowing back into the venous system, which will increase preload, which of course will cause the heart to pump much faster and harder to get that blood out into your peripheral circulation, which is of course what causes the tachycardia. And that leads to all the downstream negative effects that you can think of. Left ventricular stress, dilation, failure over time. I hope you found this video helpful. I'll see you in the next one.